thanks again, everybody, for being here. The purpose really of the next hour is essentially we've got pay consultations taking part in various sectors within UNISON, and currently the biggest one we're undertaking is the consultative ballot in the NHS on pay. We are all aware of what's happened to us and our loved ones, friends, family, colleagues, the working environment that we have been through since the beginning of the pandemic. We have heard the clapping, and we have heard the promises, and we have heard how much public sector workers are respected and valued. And it's clear that that is not being reflected in the pay offers that we are currently in receipt of from the government. As we are activists, our role is to obviously not just engage ourselves in campaigns, but it's about engaging others, encouraging participation from all our members, and where people aren't members and they want to be involved, obviously encouraging them to be involved too. I thought it would be a really good and useful thing for us to take some time and spend it with our colleagues and activists from Northern Ireland, who in 2019 ran an amazingly successful campaign in the NHS. So I would like to introduce, with us this evening, we've got James Large, who's the convener for UNISON Northern Ireland region. We've got Maura, McKenna, and we've got Conor McCarthy from the Northern Ireland Regional Health Committee, who were intrinsic in that campaign. And at this point, I'm going to hand over to yourselves so you can talk us through what you did and how it works, and we can learn some lessons from you. So over to yourselves.
Thanks, Becky, and hello everybody. So James Large, Joint Regional Convener in the Northern Ireland region. So I'll just set a wee bit of context in terms of what was the situation in Northern Ireland at that time when we were going out to ballot our members on potential industrial action back in 2019 and going into 2020. So Conor, Maura will give you information in terms of what was happening, how we made it happen, and how the membership and stuff was organised at that time in doing it. But at the time when we were going out to consult members on industrial action, it was a time when we had no sitting executive in place in Northern Ireland. And that was just one of the obstacles that was in our way. There was really nobody to talk to apart from civil servants at that time. And again, being a devolved region, being reliant on the block grant coming via the Barnett formula to Northern Ireland in terms of spending for the public sector. At the time, UNISON, led by Anne Speed, who was leading all the main health unions in the negotiations before any ballot had even taken place, she was working in the background to secure statements from all the 5 main political parties who would have been sitting in the executive in terms of a common approach that they would back pay parity, and they would commit to pay parity for health workers in Northern Ireland. But as I said, we didn't have the sitting executive, and all the other signs were stacked against us in terms of going out to a ballot and consulting with members. But that's where the organising, the members come in, and the activists meeting with the members on a daily basis, not even a weekly basis, on a daily basis, and stuff that was being done at that stage to get the word out there, to get the members angry. And to get the members involved and wanting to participate. One of the main strengths of the dispute was to focus and put pressure on the system rather than putting and harming patients. It was to put pressure on the system and to have the system chasing itself rather than actually bringing people to harm and not impacting our members as much as what a 1-day strike or a 2-day strike would have done. We were looking at a sustained plan of industrial action and how that would work, and how everyone could play their part, but actually have very little impact on them financially in terms of losing money. But Conor and Maura can go into that in great detail. But I suppose it highlights, and what it does highlight is that there should be an approach from this union to move away from the PRB and go back to proper bargaining with employers and negotiations and pay negotiations with employers, rather than submitting evidence to the PRB in a hope that they'll come back and give us what we want, which never seems to be the case. But I'll hand over to Maura and Conor, who'll explain to us about the whole approach that we had taken in terms of through the Health Committee and then through the Industrial Action Committee that was set up through that. So I'll hand over to them too, and they can explain in detail.
Okay, do you want me to go first, or do you want to go first, Conor?
No, go ahead, Maura.
Right. Well, thanks very much, everybody. As James says, we wanted to develop a process where we could get an outcome that everybody was satisfied. But this started way before that, because, as you know, with the Gender Change Refresh in 2018, that we had no sign of any assembly, so we knew we weren't getting anything. We actually started then and constituted an Industrial Action Committee from our Health Committee and from all the branches. Every branch was involved in that Industrial Action Committee. We come up with the ideas. We knew we were going to have to take sustained industrial action, but we wanted to do it in a smarter way. You know, we knew that traditionally, the people that come out on industrial action are the lowest paid. See, we wanted to make sure that we weren't having as big an impact on our low paid members. So we'll come up with this ideas. We didn't need to bring everybody out at the same time. We could bring different groups out, different times, different days, but the impact that it had was far reaching. I'll just give you a few examples. So like if we have an integrated health and social care service here, so we would have, within the social care, we would have day centres, we would have drivers and all of that. So if we took the drivers out for a day, they weren't bringing the clients into the day centre. So the day centre staff were still in situ. They were still getting paid to be in there, but there was no clients getting in. Then another day we took the day centre workers out. Drivers couldn't bring anybody in because there was nobody there to look after them. We looked at everything, and you know, within the hospital settings, the post room, if we took the post out, we weren't able to get appointments out to patients to come in. First and foremost, we decided very early on, we give a derogation. Now, everybody says to me that word is emblazoned in my mind, and we ate and slept that word for 5 full weeks. We had derogation meetings on a daily basis. It frightened the wits out of the employer because they didn't know what we were going to throw at them next. But first and foremost, we derogated children's services, cancer services, and I can't remember what the other
Blood
one was.
transfusion.
Blood transfusion. We derogated them from the word go. So as far as we were concerned, they were derogated. They would be staying in situ. Now, we also took a decision because traditionally you would have nobody should pass a picket line. And we made it very clear from the word go that our picket line, whether you went into work or not, you were still part of the industrial action. So it wasn't the old way of you can't cross a picket line. Yes, you can, because we're asking you to go in. We need you to go in this time, but we'll bring you out another time. So all of that was put in place. So even people, they were getting into work, but what happened through the whole 5 weeks, because believe it or not, I was just talking today there, and it's 2 years next Saturday that we started our first action. And, you know, it seems like yesterday, but it seems an awful long time away. So we took all these decisions, involved everybody. We had meetings with our members. We had branch meetings months beforehand. We knew what was going to be happening. We had meetings with all the political parties, as James had said. We tried to get everybody on board. But the most important thing of the people that we had on board was the public. And that was important also because they recognized the fact that we were not equal to everybody else, and we were downtrodden in that way, and we were not getting paid the same as everybody else. And I think we are very proud of the fact that we believe, as part of our industrial action, was the Constitution and the re-establishment of the Northern Ireland Assembly. I don't think it would have happened if we had not have taken the industrial action. And we hear all the talk about, you know, RCN, they took industrial action. Yeah, they did take industrial action. They went out for 1 day, and that was it. We went out for 5 weeks, albeit different groups, different days, different areas. But over those 5 weeks, the most that anybody lost in pay was 2 days. 2 days pay, and that was sustained action over the 5 days. As I said before, management didn't know what hit them. They didn't know how to cope with it, didn't know what to do. And every week, I think it was on the Friday, we sent in the notices for the following week, because we only give them the 7 days notice. And we were very clear in that. We didn't give them any further than that. We give 7 days notice as required by the law. So what we done is we give them a full list. This people, and it was on a regional basis. So we would have talked together. We had our meetings, regular meetings with all the different branches. So we would have said, up in the Western Trust, if you bring your bus drivers out today, in the Belfast Trust, we'll bring them out tomorrow. If you bring your post room out tomorrow, we'll bring ours out next week. So all of that was all done as well, and everybody was involved in it. And it took an awful lot of work. Believe me, it did take an awful lot of work, but it was brilliant. We still sort of say, we wish to have those days back again, because it also invigorated each and every one of our activists and made an awful lot of new activists that we got out of it. People that had never taken industrial action before, not like the old timers that knew what industrial action, and we didn't want to walk them up the hill halfway and have to come down again. We wanted to make sure that we were going up the hill and over the top, and making sure that everybody was there with us and stayed with us, and it wouldn't have as big an impact, because whenever you take people halfway up a hill and you cannot deliver, that's soul destroying for everybody. It's soul destroying as a union, it's soul destroying as an activist, and it's also soul destroying for our members as well. So we knew we were in for the long haul, but we knew we had to do it in a smarter way to make sure that the impact on our members wasn't as much as the traditional form of strike action would have meant on them. Conor, do you want to come in and add anything?
Yeah, of course. Yeah, in regards to just, first of all, thanks very much for the invitation, Becky. It's a pleasure to talk to colleagues and comrades across the water. Really do appreciate that. It's very refreshing. Look, I suppose the main reason why I wanted to come on and have the conversation is also to send the message out to England and colleagues in England to begin to believe in themselves and to begin to believe that things can be changed and things that could be done. We understand that it's been over 20 years since UNISON took some industrial action in regards to the scale we're talking about in regards to the NHS, but it's now time. The time has come. You know, we all have the slogan of making sure we have the faith to fight for the NHS when we're called upon. Well, now's the time. It's now being called, and it needs an answer. And England genuinely does need the answer to that, and I do believe it can. James has said at the beginning of this meeting, we need to take the step to remove ourselves from the PRB. Now, people will argue from many a platform, but what does that mean? What next? What does it mean for us to look into the abyss? I wouldn't have no fear of that. We need to release ourselves from the PRB because it is a mechanism of servitude that needs to be cut so we can enter into collective bargaining negotiations for a better outcome for us all. So it really does need to happen. So this, in this year's health conference, this something needs to be there, and hopefully we finally remove ourselves from that mechanism to deliver pay, because it's never going to deliver pay. And it's something we need to really collectively come at from one team approach. As Maura said, the context, and James are providing the context, we had no government, we had no public sector pay policy, we had no employers with no money, and we had a lot of people saying that why is taking strike for, is it even legal? The first thing we had to do was to believe in ourselves as branch secretaries, as people within working in branches, work closely with a regional team and decide to go for this, decide to go and fight, and then to see what happens next. The only failed industrial action is the one you don't take. And we all knew that. So we decided to say, well, do you know what? If there's going to be a fight, I'd rather have a fight than lose and not fight at all. And we could never imagine the outcome of that and what it resulted in. As Maura saying, it was the major reason why we were able to re-establish government in Northern Ireland. And in addition to that, the huge public support, the amount of media interest was phenomenal. I mean, there wasn't a night where there wasn't outside. I mean, James was there challenging face-to-face the Secretary of State outside his branch. We had Channel 4, we had Sky News, with BBC, with RT, with every news channel, European news channels, interviewing staff, interviewing reps, because they couldn't believe that the steps that was being taken and the transformation it was bringing about and the inspiration it was having on society to improve things. And so it had all those indirect positive consequences, and that's why it was so inspirational, and that's why it was so successful. But in regards to the issue around what England faces, part of the reason why we have this situation in England where we usually need to meet the 50% threshold is an unacceptable year upon year of tolerance that has been going on tolerating these things in regards to, and I have no desire to wish to offend anybody, but a weak labour movement, and not challenging these things to prevent these things coming into legislation. You're left with this. But the fact of the matter is that this is a consultative ballot in England that has happened. And the only thing I would say, please do not be disheartened if you get a poor, what we would be regarded as a poor return, and do not let that determine what you do next, because our return was very poor in regards to our consultative ballot. That's the nature of consultative ballots. The only ballot that counts is the one that comes through the doorstep that says it's now time, yes or no. This is the real ballot. And the message needs to go out to voters in England in regards to our branches, our branch secretaries, branch structures, regional structures. It's now time. Don't let us down. Reach the 50% threshold. Send the message out. Because if not, the union are going to be accused of constantly backing away from a fight. There can be no loss or no humiliation and people having an anxiety about not reaching the 50%. Do not let that be an anxiety. The only anxiety should exist is the one you're choosing. We're just going to accept this and we're not going to fight. Fight will always bring out some sort of action. And you don't know what's going to happen. You don't know what you're going to inspire, who you're going to inspire, and others will follow. If Unison take this action, others will follow in England. And that's why it's so important to do that. And as Maura said, the Profession Pacific strikes was the first time it's ever been done, the first time we've ever seen it done, where we decided to form a strike committee. Working hand in glove with regional staff is essential. Having those local organisers, your ROs, all working hand in glove together. 600 notices a week went to employers about the action. And for us to sit down and develop a strategy like we did, it, on the face of it, seemed unworkable, but it was also unmanageable for employers. And it was, as James and Maura said, it was huge and took its toll on activists in regards to exhaustion. But it was pleasurable exhaustion because you knew you were changing things, you were bringing about change. And those bringing out professions inspired the next profession. So when we say, everyone said to us, oh, the nurses are not going to go, the nurses will not go. Nurses was the most difficult group of staff to keep in work. And every night I had to stay in trying to provide derogation for intensive care units, for children's wards, nurses physically walking off. I'm trying to get the emergency cover in place. It was the hugest block of members we had walk out in the industrial action was nurses. Even when we had it in principle, where our regional head of bargaining, on speed, brought the government very close to saying, make the announcement in regards to agreeing this, pushing them all day long. And as I say, there was no distance between our regional staff and head of bargaining. There was daily conversations every night. That communication was vital in regards to where we're at, what we're doing, and that kept us all going. And when we thought, right, it's in the bag, I never left the room until it was literally in the bag.
10 o'clock that night, Conor, she would not let anybody leave that room.
But the point is as well, in regards to when it hit Christmas time, Christmas Eve, when people were finishing up, we were submitting our next notices for strike in January, when the government had already said that it was going to answer and it was going to deliver parity. We weren't going to stop until we actually seen parity, physically seen it. So when we submitted those notices, even HQ in London, we're saying, what are you doing submitting more notices? But that's what we were doing, and HQ in London and fair play them answered that and done that work. So just as much as we were working over our holidays to deliver this action, regional staff and national staff were doing the same. So everyone was working really hand in glove. But all I can say from the point of view from people, comrades and colleagues listening to this in England and from the Eastern branch and other branches, please have faith. Yeah. Do not be deterred. Do not let a poor outcome or a consultative ballot be the deciding factor. Oh, people didn't answer an email. So what? People didn't pay their lives not answering emails. When it's time to fight, when it's time now we're balloting people to reach that 50% threshold, which is need to do, people will answer the call. If the call sent out right, they'll answer it. Because what's going on is incredible. What's going on is unacceptable. And England has so much fragmentation. You've so much breaking up. I mean, you've got G4S and the side of your ambulances flying about streets. I mean, it's intolerable. So there does need to be a fight back, and it needs to happen now more than ever. If not now, I mean, when will there ever be a time to fight? Yeah. So I believe in our colleagues in England. I absolutely believe in our branches in England, and I believe that we can do this. So I really hope people do take the leap of faith and do take the decision to take industrial action, because it will work. It has always worked. It's the only thing that has worked, and it will work. What won't work is more servitude. Do not accept this. So as I say, I really hope people do listen to what I'm saying and listen. And if it comes to the point where it does go and the service group, please, the service group recommend industrial action that goes out there. I make a promise, I know Maura and James are the same. I have no problem jumping on a plane and going to branches every day, every night, anywhere in England, to tell people why I should take this action just as much as we're having this call now, to talk to workers and talk to the people. It'll be our pleasure, but it really does need to happen. Thanks, Becky.
But Conor, it's so important that you relay to the members that it can be done in a way that will not have as big an impact on them as they think it will be.
Yeah, absolutely.
Because I think that's the important aspect of it. But the way we've done it was the smart way of doing it, you know. So, as I said, 5 weeks of action only resulted in 2 days, at the most people losing 2 days' pay.
But people
yeah, but people think, Conor, what I'm saying, people think you're taking industrial action, you could be out for weeks and weeks, and you're thinking to yourself, how am I going to feed my kids? How am I going to do this? How am I going to do that? If I have 5 weeks losing my pay, I can't afford to do it. But there's a smarter way of doing it. So that's why it's important that you're speaking to your membership, that you're explaining to them and explaining to them all. And as I said, it started before about crossing the picket line. Making that very clear. You have to make that very clear. Even if you're in work, you're still part of the action.
Yeah,
it's not that you're not crossing the picket line.
I think what you have to remember is that when people took the action, when we said, right, week 1 will involve admin and clerical workers, and then all the admin and clerical workers were out on a Monday, and then we publicised what group were going out that week.
Yeah.
Nobody wanted to be the group that let anybody down. So it became healthy competition. So when we said, look at the many admin workers out, that inspired the support services. Then the support services went, we said, right, it's over to you, nursing, don't let us down. Nursing didn't let us down. So nobody wanted to be the group of staff that when we handed the baton over in a relay of industrial action, nobody wanted to drop the baton. So the bottom line is everyone's saying, well, actually, we want to be the biggest group to come out. And as I say, historically, I've heard people say on every single platform, nursing won't come out, nursing won't come out. Nursing was enormous.
It was keeping them in. It was keeping them in. And the thing about it is, Conor, you know, everybody was part of the action, because even they were coming on the picket lines before they went into their work. They were coming out at lunchtime and standing on the lines. They were coming out after their shift. They were just everybody, like we stood on the picket lines, and businesses were coming along with sandwiches, with tea, with coffee. We had wee men coming up to our picket line and handing us £20 to go and buy tea for everybody. You know, we got on a bus to do a protest at Stormont, and we had somebody, I know on the bus that we were on, this lady come up to me and handed me an envelope. And James had the same experience with £100 in it. This is for your strike action. This is so you can buy yourselves a cup of tea, anything at all. This is to support you, because we had, and I should have said also, there was another thing that we done, and this Mr. Large and Conor, the 3 billboards out of Ebbing. We had billboards all over Northern Ireland. We decided as a region, we put these billboards up, you know, first of all, for you to take the action to make sure that you were having your vote heard. And then after that, it was why we were taking the industrial action, you know, because we needed pay parity. Because if you're getting paid this much in Belfast and you're getting maybe £2 an hour less than you were getting in Manchester, that was wrong. So it was making sure that the public understood exactly why we were taking that industrial action. So we had the billboards everywhere, at every bus stop. You could have been standing waiting on a bus and there was a billboard there say, Unison's taking this action. And the other unions,
it's about, you're right, Maura, and it's about personalising it to the public as well, in terms of, look, we're looking at pay rise because there's not enough, it helps with recruitment and retention. And a problem with recruitment and retention is the waiting list. The waiting list crisis, you're sitting on the waiting list. You're sitting on the waiting list because there's no staff, because they're not paid properly. Get the billboard, and we took them out on buses. So the buses were driving around all the local areas with the signs on them. They were on bus stops. They were on buildings everywhere. And you're right. And what Conor and Maura had said isn't an exaggeration in terms of it was a fight to keep people in.
That's right.
When the groups started coming out, you didn't want to be the group to let people down. But reps were physically going around, please, can you go back into work? Please, you can come out the next time. Can you please go back into work? There's not enough people in there. Can you please go back in? And that isn't an exaggeration. And that is on the back of on the back of what Conor had said, a poor return on a consultative ballot. But the momentum builds when the proper ballot comes through and you go out, and the activists need to be out speaking to people and use the organising staff across your region to go in and help the reps that maybe aren't as confident to go out and speaking to the membership, but meet with the membership daily. Meet with them daily, go around the workplaces, speak to them every day, get the members in, speak to the members about what kind of action you need to take and what you want to take, and let the members decide.
I think James, I think what everybody has to understand, it's not no secret. Anybody who thinks that this sort of struggle can be done without pain is kidding themselves. There has to be pain. There must be pain. What we have to do is minimize that pain in regards to financial impact, which we were able to do in this strike by going away from those conventional methods of 1 days and 3 days and consistency in that sense. Using the professions to support each other had a ripple effect of momentum that basically brought everybody out. And even when everybody was out, even when it wasn't their turn, they were all coming back in before work, after work, lunch times, all supporting the staff who were out next. So it looked as if every day it was the same people on the picket lines, and the numbers just kept growing and growing and growing. And that's because we took the decision to do it. And this is why when the service group get that return, I really hope it's a high return in that respect, and it gives a wee bit of confidence. But I really hope the structure, I really hope the organisation listens and feels the temperature more than an email reply. The temperature is defeat. Now we need to make a decision. Do we lead? Do we actually lead that, or do we just sit back and wait to say because computer says no? You can't do that.
But
so
Conor, to get that return, you need to explain to the members that there's a smarter way of doing it, that the impact in them, and that's what you need to be doing. You need to be out now telling them, look, it's not, this is what we're thinking, this is how it could be done, this is how it could be delivered. You know, vote yes, because it's not going to have, you know, you're not going to be out for 5 weeks continually. There's a smarter way of doing it, there's a different way of doing it, and we know it can work. If you need any help at all, we will help you make it work, but it's making sure that you're telling the membership how, and encouraging them to give a positive return on their the consultative ballot. They need to you need to talk to the membership. That's the most important thing. And as Conor said before too, our regional staff were brilliant as well, and with Anne. And as I say, on the 15th of January, I was sitting in Stormont at the Department of Health, and she wouldn't let anybody out the door. It was 10 o'clock. The minister came down to speak to us. He was a newly appointed health minister, because whenever the assembly got back up and running, and the week later he came down and he said, yeah, we'll go with that. And she says, we'll go up the stairs and sign the letter and bring it down to us, otherwise we're not moving. And that's what he done. And the other aspect of it, the other main important part, not only were we fighting for pay parity, but the safe staffing, because they all worked hand in hand. You needed that safe staffing to deliver a proper service and to be able to pay people the correct amount. You know, fortunately, we had the employers also were on our side, because they knew it was wrong. They knew it was wrong that we weren't getting paid the same as everybody else. But if we had a couple of years where we were given, some of our health ministers had given us the 1%, the measly 1%, but they'd given it non-consolidated, which meant that we were at a back foot from the very beginning. We were getting paid less. Even if we had been given the full amount at that stage, we were still going to get paid less than everybody. So he agreed and gave us it exactly, brought us up to par with England. And that's what we were fighting for. But the safe staffing also was to make sure that, you know, with that many staff, they were exhausted, and they still are, even through the pandemic, etc. But it's making sure that you're talking to the membership and making sure that you explain to them how it could be done in a smarter way to try to get that positive returns.
Brilliant.
I suppose it's important to say, Maura, just before you finish, that the industrial action that we took, it wasn't full days. We didn't take people out for full days. We were taking them out for a few hours in the middle of the day. So nothing could be done in the morning, nothing could be done in the afternoon. They're in work, they're getting paid. Yep,
exactly.
Thank you. Thank you ever so much to all three of you, James, Conor and Maura. Really, really inspiring. I did say to you, James, when I spoke to you about doing this, that I was ready to go out on strike when we spoke. I'm now going to go and strike somewhere now, just because I'm going to ring some members. They're not going to maybe like that, but I'm going to do that. Before I open up to any questions or comments, because it would be useful if there's anything that anyone's sort of thinking or anyone wants to ask, or just to make a general comment. If Sam's still on it's online. Yeah, so Sam Hemraj is with us, who's the Vice Chair of our Eastern Regional Health Committee and is one of our service group exec members. So Sam, are you able to sort of just give us an overview of where we are, where we stand, and also if there's been any talk at the Regional Health Committee that you can update us on, or how you can feed this back to the Health Committee?
Yeah, so members should have received their ballot via email. One thing has popped up, that if you've registered to UNISON via email for your NHS email account, the NHS service blocks that, so you're not able to use your NHS email address to vote. So the suggestion is that you forward it to your personal email to vote. So that is one important thing, and that's what reps and members need to get out to their membership. The the ballot closes on the 5th of December. It's really important we get people to vote yes, they're prepared to take industrial action, because if we don't take the industrial action, we're not going to get the government to change their mind. If you haven't got a ballot yet, then ring UNISON direct and they will then send you one on. Listening to Maura, I think as a health committee, we've got a meeting next week. It's really important that we sort of plan a strategy that if we do go to strike action, that we plan similar to what Northern Ireland has done. And also, as Maura said, is speak to our members and say, actually, Northern Ireland did it like this and we can do it like that. You know, we're not expecting you to come out for the whole day. We're only asking you to come out for a couple of hours. I did it in 2015, my first ever strike action. I stood on the picket line. My ward manager was wondering where I was for 4 hours. They said, oh, Sam's on the picket line with a few other members. I was there with Unite and the Royal College of Midwives, because the midwives are quite a militant bunch of people. They're actually not balloting their members at the moment, which is a bit of a surprise. But yeah, we can do this, and we do need to get that 50% threshold for people to come out for the government to change their mind. So yeah, that's what I've got to say.
Yeah, brilliant. Thanks, Sam. And taking on board what Conor said, you know, obviously my background, I am in local government. So obviously next month is my month to move in terms of being a steward and a rep within my local government branch. But there's the fact that we need to be actually listening to what people are saying. And obviously the feedback isn't just the email that's sent. It is what people are actually saying, and talking to our members and feeding that back, especially to our regional health committee and our service group members, I think it is going to be vital, so that we can keep up that engagement. A lot of people are feeling really, really browbeaten after, you know, the everything that's been happening and the continuation, and we're coming into winter, and now's the time for that fight to not drop, but we need to be the support mechanism that's there for our members and for each other as activists as well. We need to be driving each other. And I think when certainly when you were talking about obviously each different parts of the hospitals and the trust coming out, and then it became a bit of a competition, I can definitely see how that would work. But also that's a different type of collectivism, isn't it? Because you're looking after each other, and it's the very essence of collectivism. You're doing your part, but you can see how you're doing your part as well, can't you? So there's some really big things there, and it's good to hear Sam saying about taking that back to our regional health committee. I will take some questions. Oh yeah, sorry, Sam.
Come back on there, Becky. Just for one thing, and this is a massive plea for the members that are actually online. Obviously, we're in COVID times, and a lot of hospitals are not allowing recruitment stands to have pay discussions with our members, because in the last pay round we were able to go around the wards and have stands and do everything else. Well, a lot of trusts are not allowing that. So if you're a member, speak to your colleagues in the workplace, so then it goes down the line. And that is one thing, because there is not enough reps to get round the whole of the place. So by asking the membership to actually speak to your colleagues about it, that will help us, because, you know, time is of the essence. And as I said, it's really important. If you haven't got your ballot vote, then ring UNISON direct. And if you're on an NHS mail, either change your NHS email, your membership email to your personal membership, or move it to your personal email address so that you can vote. Because, as I said, the NHS databases, they just block the emails from Unison.
Becky,
That's handy.
Becky, can I say, in regards to that, what your colleague was in saying there, in regards to getting the message out and restrictions we're currently we're faced with a lot of those restrictions. Do it in the car park, set a marquee up in the car park or a field, a roundabout. I don't care where you do it. But the bottom line is, it's get it out into the community, into the streets. You can talk to people in the community, in the streets, talk to people via the social media, and don't, if getting the threshold to hit 50% is solely based on electronic methods of communication, it will be very poor in that return out. It's about physically taking it to the streets, physically taking it to our communities,
Physically taking it to the members.
and talking to people, encouraging members. And you know, if hundreds of people are walking into work in the morning and they see marquees and they see tents and they see things getting and they're loud and telling people to vote yes, people will respond. They're a lot more receptive to those things. We certainly find that out. We find that anyway.
Thanks, Conor. Thanks, Sam. Yeah, we've got about 15 minutes left of the session. So, Shona, you've patiently been waiting with your hand up. Did you want to come in with a comment or question?
Yeah, I was just going to say, I really like this idea of the, you know, so the action is not everybody on the same day, but how you keep serving those notices. It's going to be the drivers, it'll be the post staff, it'll be cleaning staff, because I think that's going to have a bigger impact and keep them busier. And I do think another thing to remind people is that if you're going and taking one day off work to stand up for your pay or your rights or whatever it is you're standing for, I did it in the pension, you don't even see a difference in your pay at the end of the month. I think if anything, I maybe had a wee bit more in my pay packet because the tax man got a wee bit less. So I think there's that to be encouraging people, saying if you're going to take even one day's action, you will feel no financial detriment from that.
Mm-hmm. That's what we did explain to them, Shona.
Yeah.
And that's why it was important that everybody knew it was going to be sustained, but it will not have as big an impact on you. But there's one observation I want to make. Why the hell do we have to take industrial action in the middle of the winter? Because we had the worst weather ever. We were soaked to the knickers.
It was the same with the pension one. Yeah.
But it was worth it.
Becky, also, Becky, is you have to remember as well, when a group went out, that automatically triggered whatever group was out. There was also a submission of a notice for an overtime ban for the same group. So so for a 24, so that if we were bringing admin clericals workers out from midnight to midnight, that also meant that there was a physical walkout in the sense where they withdrew their labour, but it also meant as well that there was an overtime ban put in place. So even if we had the issue where we had any concerns, which actually wasn't a concern at all in regards to scab labour, it was when in nobody dared do anything that any worker was out in strike on. So nobody touched a bit of paper or a computer that somebody had left or vacated because they withdrew their labour on overtime. So even the managers and so forth, they couldn't offer any additional hours overtime out. They knew they couldn't, because just the anxiety around that was created about, no, you just don't accept it. So the message was clear, so that's why that momentum is really good, because if you have a whole group of financial health service workers out, a whole raft of people can do things in the background that undermine the action. But when you take a specific group, then everyone's focused on that group. So everything just stops, because if anybody does try to undermine that action, it's so self-evident and nobody wants to be in that position.
Yeah, and that was the other thing. And Conor, you're right, in terms of all them notices, the work the rule notices that we're getting in every week as well. And how they were changing and how detailed they were. So you have the like supporters, they weren't stacking jobs, they were doing one job at a time. They were doing one job, going and doing the job, coming back, waiting 5 minutes, then clearing their job. They were taking the full allocated time for their jobs. That grinds the whole system
But
to
we
help while the
needed
other
to be
staff
very
out.
careful during the derogation, because managers were asking, they needed a derogation because they were identifying how many staff they needed. And you see in some areas, they needed more staff in industrial during the strike than they had the week before in normal practice. So we needed to be very careful and very smart and have all our details with us.
Brilliant. Yeah, good to hear from you, Shona. And yeah, the overtime ban, it's and like you say, when you're working in smaller groups, it's not just owning the action, but it's also about accountability, isn't it?
Yeah.
And if someone wants to go against that, you know the faces and the names of those people that you're letting down. It's not a movement, is it? It's actually the people that you know and work with and respect that you are either helping to support or you're going to be letting down. And that emotional buy-in, as well as the reassurance as well, you know, and that, like you've said, that does take time and that takes effort. But, you know, again, if it's not going to be now, when, ultimately?
Absolutely.
Rad, do you want
and Shauna's absolutely right. Sorry, Becky. Shauna's absolutely right in terms of the whole financial piece as well. Catering staff, if you're taking catering staff out, you take them out for 3 hours over lunch. There's a whole lunch service disrupted. They're not losing very much money, but the system's chasing itself, trying to feed patients. And people just need to be smart, and they need to speak to members. It's the members that know. It's the members that are working the jobs that know what to do and what hurts.
Perfect. Rad?
Thanks, Becky. Yeah, I just want to say thank you again to our colleagues from Northern Ireland. I can only echo Becky. It's been really, really inspiring, and I think we've got some really good ideas and things we can take forward. I do have some questions. Conor, you mentioned that the consultative ballot that you ran in the region was poor in terms of response. What sort of percentage did you get back, just out of interest?
James, keep me right here. I think it was around 11%. I think it was
11.
very low.
Okay, thank you. That's really helpful, because I think
Good. Yeah.
I think we were looking at an average of around 28% in England. So okay, that's helpful, because I think we can maybe build on that. Got another couple of questions. So the first one, so obviously we heard some fantastic stuff about nurses champing at the bit to come out on strike, which is fantastic. And I would love to see in England, I would love to see that, because, you know, the nurses and the HCAs, the people on the front line, is such a powerful, they're the most powerful group within health. If you get people in uniform out on a picking line, it sends such an amazing message. So to hear that they were champing at the bit to come out is fantastic. But did you have to manage the anxieties of those individuals? Because when I talk to nursing staff and other frontline clinical staff about coming out on industrial action, the first thing they say is, I can't abandon my patients. And I understand, you know, the smart actions that you've taken, but how is there a way? Did you have a script, or did you have something prepared to talk to those individuals?
Yes.
Yes, we did, and that was why we gave the derogation, because we sat with the managers, and what Christmas Day cover, that was our terminology. You tell us what you need for Christmas Day cover, we'll give you Christmas Day cover.
Okay, that's fantastic.
More. You know, so if you have Christmas Day cover, and we'll say, you know, we went round and said, right, you decide among yourselves who's going to stay in, or you can do it in relays. You can come out for 2 hours, you come out for 2 hours, but we use the terminology Christmas Day cover. That's
great. I mean, my branch did something similar in terms of 2 hour sort of protests for a local issue, and it was really successful. So it can be done, and I think I can use that example to talk to the members, certainly in branches. My last question, with regards, so clearly, you know, people coming out for a couple of hours of time, 3 hours, you know, so essentially 2 days total over 5 weeks. But did your branches come up with, were you allowed to have hardship funds? Because there must have been people that even 2 days, losing 2 days wages is actually a big deal to some people, isn't it, when you're looking at the lowest paid?
Well, they actually give us a straight pay back.
Wow. That's incredible. That's incredible. Okay. Thank you. That's all of my questions. I think
Rod, they were afraid of us doing it again. I think they just said, well.
But believe it or not, we didn't want it paid back, because whenever you decide to take industrial action, you stand for a cause, and it was really you just made that decision. I'm taking industrial action. I know I'm going to lose a bit of money, but as Shona said as well, when you're talking about the tax implications, it wasn't that much really, when for those periods of time.
And that's really helpful.
And it annoyed us that it paid us back.
Well, you have to also understand that with the nature in which you're taken out, it's so difficult for managers to monitor that, about who's going, when they're going, and how long they're going for. I know, despite what everybody says, I know a significant amount of people took action that didn't even get deducted.
That's right.
Yep.
Because it was too difficult. It wasn't like you're going out next week on Monday. So therefore, there was a workforce there. You just hit the button and sleep off, not in work. But not the way this was done. It was managers actually said to us that they called it was whatever evil genius come up with this and all the rest, that sort of language. But basically they had said that this is making it unworkable for us even to tell who's in, who's out. And the payroll hadn't got a clue. So there was the big days where everybody was out, and they were sort of easily regards to deductions. But the days where there was sporadic, it was very, very difficult for deductions to even take place.
I suppose we're biased when we say we think we've done it right, because again, it wasn't even the same across the health trust, so they couldn't even communicate with each other in terms of the management in each health trust. What are we doing here? Oh no, what's being hit in your area? Oh God, no, we're this. Oh God, you said that. So it was mayhem for them.
And we do threaten them every so often, and they'll go, "Oh God, please don't. We couldn't do that again." But I know from my own point of view, I went a couple of my shifts that I went out, but because it was only 2 hours of my shift, because we give the timeline and it only affected 2 hours of my shift. One of my shifts I didn't lose any money on because I didn't bother putting it through.
To be perfect, I mean, I know that may be controversial, and it may be, but you need this from the leadership point of view as a branch secretary, and you need to set the tone. I feel as well. When I met my branch and our branch committee, they were fantastic. The branch committee knew we were all on the same level of thought. I didn't have to convince our branch committee to vote yes for industrial action. The biggest anxiety within our branch committee was, why have we to do this legally? Why can't we just walk out, sort of, and trying to convince people to actually stick with the process. But when we met members in our branch to talk about the need to take industrial action, I mean, there was literally hundreds of people in meetings that couldn't fit into rooms, couldn't fit into lecture theatres. We never started off the meeting with, look, we need you to vote yes, or we need to take industrial action. We told them you're taking it. We told them you're taking strike action, and this is why you're taking it. And that was received. That was received loud and clear, and with respect, because the members could see that here's a group of people showing leadership. Here's a group of people saying they're going to take this on, and they're speaking our language, and I like it, and I'm going to back them, and they're backing us. So that comradeship over that time was clear. So when we and some people, do you know what? In the situation we're in now, particularly with England, you do not have no option. There is no option not to fight. So I personally wouldn't be giving members an option. They've no option. It's now time to struggle. It means nothing saying on a t-shirt, the NHS will last as long as the faith people fight for it. Now is the time to put that into practice. It really is. So it's really putting it to people and say, look, step up, we're with you, we're backing you, everybody's backing you. And I think if I absolutely really look forward to the day, if this happens, and I hope it does, and UNISON in England do take the decision to take strike action. Honestly, I think it'll change UNISON forever in England. It really will.
The problem is that we didn't have we don't have the threshold here. On our industrial action ballot, I think it was actually 28% on the industrial action ballot that we got back, which was quite good, but not only did we have the industrial action ballot, we had spoken to the members. They may not have returned the ballot, but there was a big push on actually having members' meetings. We knew the mood of the members, we knew we could deliver. And that was the important aspect of it. It was actually talking to the members, even though they hadn't responded. And you said, why did you not return your ballot? But we knew the mood of them, and we knew that we could deliver on the industrial action the way we planned it. And that's important. So it's explaining to members, you can deliver this way. It's a smarter way.
Yeah. I mean, it's clear that obviously since 2016, you know, we have that target, the 50%. It's a big target, especially in big sectors.
Yeah.
But I mean, I think that I'm just gonna pay for Conor to come over and tell everybody, and I think we'll reach that threshold in probably a week, if that. So
you have to believe it. You will.
Yeah.
You will.
Yeah, and I think that although we are at the very end of the session, we've only taken a couple of questions, but I appreciate everything that you've really imparted to us this evening. I hope everyone's found it really useful. I applaud everything that you've done, and I think that there's a model there that not just we can look at within an NHS, but in any dispute that we've got in terms of what we're looking at with our employers. I certainly looked to do something similar when I was going to take some bin workers out a few years ago, and that we were going to be, it's about smart striking, smart industrial action, isn't it?
And Becky, as Conor said, as you know, we like to talk. As you can tell in this evening, we like to talk. So we will talk to anybody, anytime, anywhere, you know, but we're very willing to explain to people how it can be done better. You need to tell your members.
Thank you.
And I apologise that I have to, because they might think I'm on strike this evening. I have to go on a shift now.
No, that's absolutely fine, and we need to wrap it up. But we've given everyone a really good overview. You have of what you've done. Hopefully, people will have a lot to think about. It might be that you get another invitation from the Regional Health Committee, so I wouldn't rule that out coming your way. And just to say that next month I'm looking at the moment to put on another webinar, and we're hoping to get someone from the Glasgow Equal Pay dispute to come and talk to us next month as well. So obviously a dispute, successful large dispute, and obviously you're all welcome to join us. It won't just be for Eastern colleagues, so you know, you'd be very welcome to join us. But sharing success within our union is something we don't do enough of, so I appreciate you taking your time. Becky, to come
can I say one last thing before you go? Another way the other way that we can get money in people's pocket is through our PayMax campaign, and would encourage anybody to join the, I have to say it, Pay for Patient Care webinar that's on in a week or two. So please go to that as well.
Brilliant. Yeah, that's fantastic. Well, thanks everyone for joining us. Thanks for yourselves for coming and talking to us. And thank you to yourselves who sat there, and hopefully you've got something out of it. You can feedback to me if you want to, or obviously if you want to know more, you can contact myself through your member of staff regional organiser, or some of you know me direct, so just give me a shout if you want to. So thanks ever so much. I'm going to leave everyone to their evenings. Appreciate your time. Take care, solidarity, and I'll see you on the picket line.
Thank you
very much.
Thanks, comrades. Thank you.